Hi everyone, we are the Asthma and COVID-19 group from Dr. Brady's CSM 15 class. My name is Lily Reyes and I'm here with Richard Godinez. Next slide, please. So for our introduction, COVID-19, also known as the coronavirus pandemic, is an infectious disease that attacks the respiratory system. Asthma, an inflammatory lung disease, is also an ongoing epidemic in California. So for our problem, the recent COVID-19 pandemic has sparked many conversations about prevention, causation, and many more. What we want to research is if there are any certain factors that correlate with catching COVID-19.
So our two main research questions on what could propagate the spread of COVID was RQ1, which is does the act of having asthma or previous asthma cases increase the chances of an individual dying due to COVID-19? And our RQ2 was does air temperature have any correlation with COVID, such as does colder environments prevent the spread or propagate it?
So for our data collection and methods, we want to emphasize that we did not collect this data ourselves, but we did find credible resources for our research. So what we want to do is record the number of fatalities due to COVID-19 in the Central Valley over 1 year, record the number of asthma-induced hospitalizations in the Central Valley over 1 year, record the monthly maximum temperature in Fresno County, and record the monthly number of COVID-19 cases in Fresno County.
So here is our results for the first research question. So the orange line here represents the total number of asthma cases per county in California in the Central Valley. And the blue line represents the total number of COVID deaths. Now, first of all, one might assume that the reason there are spikes is because each of these counties have varying number of population. However, each of these data sets has been normalized by 1 case per 5,000. That is not the case. Also, if you convert this data to a scatter point line, the R squared value, which is how strong the correlation of the two different data sets are, is 0.981, which is showing a very strong correlation in between our two numerical sets. This is then broken down into this slide, where if this data is true and asthma does cause greater COVID death rates, it means that individuals with COVID have to be much more careful than individuals without, due to the compromised situation of their lungs. This data has also been backed up by the CDC, which has found a correlation in between it as well.
So for our research question number 2, this graph shows the average max monthly air temperature in Fresno County in comparison to the number of COVID-19 cases in Fresno County. So this data collection from March 2020 to February 2021, the graph shows that there is a negative correlation between the two variables. The R squared, which measures the strength of the linear relationship, is equal to 0.252. What this means is that any value less than 0.30 suggests that the strength of the relationship of the variables is none or very weak. So what this means is that temperature does not affect the number of COVID-19 cases. What we originally hypothesized was that temperature does affect COVID-19 cases. So we thought higher temperature means higher the cases, but it is proven wrong. For example, the coldest month, which was December at 56.1 Fahrenheit, had the highest cases of COVID-19, which was 38,360. So more factors other than temperature do affect COVID-19 cases. So for example, activity outside could affect the cases in other regions of the world, such as summer vacations or breaks or holidays, which could lead to spikes in COVID-19 cases.
So what all this means is that asthma, while it damages the lungs, which is a known fact, it is permanent. It also means that COVID then exploits that permanent damage and uses it to destroy your respiratory system at an accelerated rate. which means if you do have lung issues, you must be extraordinarily careful when going out in COVID hotspots or really out at all. Um, our other data set then showed that regardless of temperature, COVID is still prevalent and spreading, meaning that you cannot avoid it if you live in a particularly hot or cold area. It is still as prevalent everywhere, meaning you still must follow the CDC guidelines on wearing a mask and social distancing and receiving the vaccine when available to ensure that you have the maximum chance of um, being immune or safe from the COVID pandemic. Here are our references. If you have any questions or disagreements with our data, here's the information we used. Please feel free to use it. This was our presentation. Thank you for listening.